Good afternoon, everybody. Thank you, and welcome to our second webinar this month on energy and health partnerships. And this month with a focus, or this week with a focus on Missouri and Northeast Community Action Corporation. We're excited to have Carla Potts here, Deputy Director with NECAC, to share with you about some exciting partnership work that she's been able to engage in Missouri. And I'm Catherine Maddox. I'm Project Director here at the National Community Action Partnership for Energy Partnerships. I just wanted to share a few quick technical notes before we get started. This webinar will be recorded and made available to you all through both the follow-up email and on the partnership's website within the next couple of days. Please note that you will be muted for this presentation, but you should be able to hear us out of your computer speakers or through the phone. And if you lose audio at any time during the presentation, please click the Communicate tab in the upper left-hand corner of your screen and select Audio Broadcast to reboot your audio. If you continue to have audio issues, you can also call in to the session using the teleconference number located at the bottom of your confirmation email. Okay. So just a little bit about our project here at the National Community Action Partnership. We are funded by the Department of Energy to offer training and assistance to the WAP network in designing private partnerships and programs to leverage those federal DOE dollars. So we are interested to hear about partnerships and opportunities that you're pursuing at the local level there or through your state association. We're interested to engage with you and share with you ideas on how we can be assisting you with those partnerships. And just to share an overview as well of the plethora of different training and technical assistance offerings that we have here at NCAP. I just want to share some of those. So management and operations topics to include organizational standards, analysis, board governance, succession planning. So those are a few topics there, and then also several related to innovative practices. So two-generation approaches, financial empowerment, racial equity, also definitely related to weatherization leveraging. And I do have my colleague here, Lauren, as well with me, working here behind the scenes, and she's focused particularly on census-related work, so that's also a topic that you hear quite a bit about. And we typically have webinars often on Wednesdays, so feel free to join in on those, 2 o'clock Eastern on Wednesdays. We do have them on other days of the week as well, but you can be quite sure to tune in on Wednesdays. So please sign up and check out what we have on our website and which topics you'd be interested in joining in on. Okay, so I'd like to introduce our speaker for today. We have Carla Potts, the Deputy Director for Housing Development for Northeast Community Action Corporation, located in Bowling Green, Missouri. Carla has been with the agency for over 40 years. She has management and oversight of all housing development with a portfolio of over 13,000 units developed and owned by the agency, with over 800 of those managed by the agency. Carla also has management and oversight of weatherization, home rehabilitation, and self-help housing programs, home ownership counseling, and down payment assistance programs. Carla is also in charge of developing new initiatives, including Healthy Homes, 502, homeowner loan processing for USDA Rural Development, and Aspire Partnerships, a prison homes program. Carla is a certified community action professional and holds an undergraduate degree in history and political science and anthropology and sociology from Webster University in St. Louis. All right, with that, I introduce Carla Potts. Thank you.
Thank you, and good afternoon. I want to talk specifically today about our Healthy Homes program and how we've built partnerships with that program. As Catherine said, I've been with Community Action a very long time and was with weatherization almost from the inception. And so we know we've spent a lifetime making homes more energy efficient, and we should, but we've also now seen that our homes can make us sick. And what do we do about it, and who are natural partners to work with us in that endeavor? And of course the answer is anyone in healthcare, hospitals, insurance companies, are natural partners for us. So I'm going to begin by saying I think in community action we are probably the very best at thinking out of the box, of coloring outside the lines, but I think we have to continue to do that. I have a medical professional with Mercy Hospital in Kansas City who's been working with Healthy Homes for a number of years, and he said we have to determine how we are going to bridge that gap between healthcare and housing. Healthcare needs us, and we need them to help the people that we serve. So how do we bridge that gap? And it's a big gap. So how do we do that? Well, I'm going to give you some examples of what we're doing. In Missouri, we found out that United Healthcare had created new positions called navigators. And they were navigators in the area of housing, social determinants, and transportation. Seemed like a natural opening for us to talk about healthy homes to United Healthcare. So I reached out to United Healthcare. Not quite so easy when you reach out to a large company like United Healthcare and you don't know who they are, but you know the position. That didn't work well because they didn't know what I was talking about, who I talked to. But in the world of community action, we know you don't give up. If it is right and just, you continue to pursue it. So we kept pursuing the navigators, and I happened to be at a supportive housing meeting, and two people there introduced themselves as United Healthcare, social determinants, and housing and transportation navigators. So after the meeting, I went up and said, this is who we are, this is what we do, how can we work together? So we started building a relationship because, you know, it takes time. They don't know us. We don't know a lot about them other than the general information we have about United Healthcare. And so how do we build that relationship? How do we show them who we are and what we do and our value to the people that are their customers? So they came out to an affordable housing ribbon cutting. They came to, and I saw there are people from Missouri on this call, and thank you for joining. They came to one of our Missouri Energy Housing State Professional Alliance. And so we just continued at every opportunity to tell the story and to tell the impact that what we do can have on their customers. So are we seeing outcomes? Because, you know, it's always the proof is in the so what. We had a person in Missouri who was our CSBG director for many, many years, and he said on everything we do, we have to answer the so what. Well, what are we seeing? What is the so what from United Healthcare? Well, we were invited to meet with their chief medical officer in St. Louis. Twice we've met with him, and each time he says, why would we not fund you? And the answer is, I don't know why you wouldn't fund me, but you should. They asked us to submit a proposal to them and really tier our work, level 1, level 2, level 3, and put cost to each one of those levels, those tiers, so that they could purchase so many tier 1s and so many tier 2s and so on. They came out and saw a home being weatherized and healthy homes work being done. The chief medical officer, the chief financial officer came out, the director of nursing came to a home, which is really important. When we can showcase what we do and tell that story and have our our people being helped, our clients tell our story too. Nobody tells it more powerfully than they do. And her children had asthma or have asthma, and what the difference our work was making. So very powerful to be able to do. We've talked to the New York City, one of the main offices of United Healthcare, and she stated that community action is just the type of agency they need to be funding. She came from community development work, so she knows what we do. One of the things that I think is different is we have to learn their language. Their language is different than our language. They have to learn our language too. And there's a gap between what we talk about and what they talk about. And this lady in New York made that really clear. And she said, I'm not sure I like this word, but she said, you talk about squishy results. And we do. And we do. Healthcare is not squishy. Healthcare is all about data. We do data too, but we tend to tell the stories. But she ended by saying we need to be a little more squishy, and we can always be more data-driven. So with our pilot that we hope they're funding soon, and we'll continue to talk about that, they're going to furnish all the data from the work we do in that pilot, which is really important for us. And we're going to furnish some of those stories for them. So, learn their language, help them learn our language. How long has this taken? Well, nothing is fast. The chief medical officer brought to my attention at one of our meetings that they are the 6th largest company in the world. And I remember thinking to myself, and I think I said this to Catherine and Meg, I remember thinking, what in the world am I doing talking to the 6th largest company in the world and think I'm going to get money? And my other side of my brain said, because what you do is right, and you are. So because they are the 6th largest company in the world, they don't move very fast. So we're still working with them, but I think we're in the 3rd year. We're starting the 3rd year of building that relationship, of them getting to know us, of us getting to know what they want. And I think we're getting closer and closer to them funding something, which would be a major thing for community action. And I know people across the nation are working with insurance companies, and we need to continue to do that. All of us need to continue to tell our stories. To continue to move forward and not just sit and wait for United Healthcare to act, and to continue, as one of my friends likes to say, color outside the line. We are a Neighbor Works organization also, besides being a community action agency. So we are joining with the other 3 Neighbor Works organizations in the state of Missouri, 2 in St. Louis and 1 in Kansas City, and the Midwest region of Neighbor Works America. And a man named Kevin Kennedy, who is a pioneer in the area of healthy homes, does lots of training on healthy homes, but more importantly works with healthcare industry on how to build a healthy homes program, and has funded our Neighbor Works counterpart in Kansas City for a number of years with a Healthy Homes grant, and he will be there. We're hosting a lunch and learn. We think that sometimes getting to the right person in a hospital, and I'll talk further about that in our work with hospitals, is sometimes difficult. We can't always get to who can make those decisions, and we find ourselves trying to work our way up, and that's a lengthy process. So we think of the lunch and learn that they are more likely to come to a lunch, and they're more likely to come because there's someone from a hospital there, someone who has done this. So our lunch and learn will be starting out kind of just telling who we are. Why would you invest in us? Here's why. Then Kevin Kennedy will speak to bridging that gap between housing and healthcare and their work. And then our agency and the others will talk about what we've been doing and some of our results, both data-driven and squishy. We have confirmations already from the Sisters of St. Mary Hospital, United Healthcare, Athenia Healthcare, and Barnes Jewish Hospital, large hospitals in St. Louis County. We think that sometimes we just need to get in a room and talk to each other. They don't know. I had a hospital say to me one day, "We're not housing people. We don't know what to do, but we do know that sometimes we release patients to go home to homes that are making them sick, and they come back to us in the emergency room visit or in hospitalization, and we don't know what to do." We do know what to do. Those of us on this call do know what to do in terms of housing. So we just need to all get together, talk about what their needs are, what they're seeing, and what we can do. We need to step up. We need to let them know our capabilities. So tell our story, tell our results. So I would encourage you, if you're just starting out or if you've been working with this for a while, think about doing those lunch and learns. Even if you're in a small area, you're not drawing from a major metropolitan area, you have healthcare providers. You may have a hospital closer in your county. You have insurance companies that do the managed care for Medicaid. Have a lunch and learn, invite them to come and just tell your story to them. What I hope to come from this is that they see that we're a good investment for them to put money into to help them and their patients. That's what I hope comes from this. Now, I'll kind of go back. I'm going to backtrack just a little bit, and I'm going to kind of talk about when we started this. We started this with a partnership with SSM Hospital, who is coming to the Lunch and Learn. We started as a partnership with ourselves and the Community Action Agency of St. Louis County. And we didn't know a lot. We knew that there was a need. We were seeing it. We knew hospitals were seeing it. We knew that they were losing reimbursement because of repeat admissions for people that had respiratory illnesses that may or may not be being caused by their home environment. And so we said, let's go talk to them. And we did. And like I said, we didn't know a lot. We didn't really know who to start with, but you don't know till you try. And we ended up with their emergency room staff, their emergency room medical director, and their in-home, their home health people. And we did a pilot with them in St. Louis County and St. Charles County. The pilot went well. We saw real results. We know they saw results because they talked about the admissions for the people we serve. The emergency room care dropped. So we know there were results. Their director of community health, who is coming to the Lunch and Learn, said that healthy homes is central to one of SSM's community health strategies. That's a great quote. Healthy Homes is central to one of SSM's community health strategies. Hospitals have community health strategies. Insurance companies have community health strategies. We need to work to make their strategies work by what we do to make a difference in people's lives. How did we fund the SSM? Because SSM didn't put any money up front. How did we fund it? Well, we were really innovative and creative in how we funded it. We funded it through Federal Home Loan Bank. We got $50,000 from them, and we did Healthy Homes work along with some other rehabilitation that affected Healthy Homes, roof replacement when it was a leaking roof and causing mold. So we used their money. We received Wells Fargo Foundation money, $20,000. And I always have to tell this story. The very first home we did for SSM, we did a celebration. The woman had numerous, she had COPD, lived in an apartment, wanted a screen door, but she needed a lot of other things. We went in with a HEPA-vac. We did thorough cleaning of the apartment. We did mechanical ventilation. We put a storm door on so she could have her door open and let some fresh air in. We asked SSM to come, and they came, their home health people, their public relations people, and we invited Wells Fargo Foundation to come. I can tell you they loved the Healthy Homes program. So if you ever think about funding, look to Wells Fargo Foundation because they loved the program. The really interesting thing was that we invited the office that we had worked with the most in St. Charles, and they invited all the other Wells Fargo offices in that area, and we had more Wells Fargo people. We often said it was like the clown car where people just kept getting out. Well, Wells Fargo people just kept coming. The long story short on this lady is that her health improved to where she could go back to work. Made a huge difference in her life. We also funded the program through Rural Local Initiative Support Corporation and received $14,000 from them. So the thinking out of the box, now we're going directly for healthcare dollars from the hospitals and from the insurance companies. So the key is, build the impact, show the impact, show who you are, show you're worthy of an investment of their dollars. We know we are. They don't know that. And now the so what. So what? We're working with United Healthcare. So what? We had a pilot. So what? And I'm going to tell you squishy stories. I'm going to tell you about a gentleman that we weatherized and did Healthy Homes in Hannibal. And when we walked in the door with 2 TV stations and a newspaper, the first words he said was, "I have asthma and I have never felt better since this work was done. It has made a tremendous difference in my health." We didn't ask him to say anything. We didn't even talk about that. That's what it made. That's what he got. That's what he remembered. That's what had made the difference in his life, in the quality of his life. We had a lady in Warrenton, and I always tell this story, and I tell it for many reasons. I tell it because it made a difference. I tell it because it was important that the hospital saw the difference it made in her life. It was important for her. That's the most important. But it's important in terms of what community action is and what we do. We had a referral from SSM of an older lady who had mold in her basement, and she was on oxygen most of the time because of that added, health risk of mold. And she didn't know what to do. She didn't have the money to fix the leak. She didn't have enough money to remediate it. She didn't have any place to go. This was her home. She owned it. She didn't have choices. So we went in and we found the leaks, which is the most important thing, and fixed that. And then we remediated the mold in her basement. And I tell this story again because this is who we are. This is why healthcare should invest in community action. She had totes she had made porcelain dolls, and she had totes of the things that you use to make porcelain dolls, the heads of the dolls. And she said, I just wish I could, sell them because I know they would bring some money, but I can't do that. Our guys took those to a local auction and sold them for her, brought them back, cleaned her totes out, brought them back to her. That's the extra mile we go. That's why you should invest in community action, because what we do is not only right, it's just, and we make a difference. So that's the kind of story we're going to tell at our Lunch and Learn. The difference in her life is that she is now on oxygen just about half the time that she was on it before. SSM said they had never seen such a difference in her life and in her quality of life. That's what we do. That's who we are. And I'm going to tell about, I have up there, we have a state senator who doesn't really like a lot that we do. We all have some of those who aren't thrilled with everything we do, but he likes weatherization. And I was up visiting him, and he was busy and didn't have a lot of time, and I said, but we do healthy homes. And he said, come in and talk. Let's sit and talk. I'm an allergist, and if I could prescribe anything, I would prescribe healthy homes. We have used that statement from him many, many times, and he actually has been of some help to us in terms of reaching out to United Healthcare. He's been some help with us since SSM. He actually practices at Mercy. But you never know. You never know what kind of relationship you can build. Again, there is a big bridge. There is a big gap between housing and healthcare, a big gap. But we can bridge that gap. We are the ones who can do it. We are the experts on housing. Again, I quote this gentleman who was our CSBG director for many, many years. We're the experts on poverty. We're the experts on housing. We know how important housing is to the health of our residents. We have to be willing to color outside the lines, talk to people, tell our impact, and continue to push forward. It takes persistence. We're at 3 years with starting our third year to move United Healthcare. I am convinced we are going to do it, but I've never moved the sixth largest company in the world. But I am convinced that we can, and I think if you're United Healthcare, if they're the sixth largest company in the world, we know they're everywhere. I think all of us, if this is something you want to do, you've thought about doing, you are doing, reach out to United Healthcare. The more of us reaching out, the more of us telling this story, the more of us showing the impact that we have, it is important. I say all the time, I've been doing this for 40 plus years. What we do is right and just, and we just need to show people that, and we need to show our impact. Nobody wants to invest in somebody they don't know, but we know who we are, and we know the story we can tell, and we know we can show our impact so that we can bridge that gap. Bring a medical professional in. If you've got someone like a Kevin Kennedy that knows the impact of healthy homes, bring them in. Let them talk. It's important for those hospitals and those healthcare industries to see somebody that they know, that comes from their industry saying, this is going to help your patients. This is going to help you. You need to build that gap. You need to work with them. That's really important. I'm going to pause right here and take any questions. I've been kind of out of the corner of my eye watching to see if any pop up, and I haven't seen any. But I'm going to stop right here and see if anybody, wants to post a question, anything. If you want me to elaborate on other stuff, I'm more than happy to do that.
Great. Thank you, Carla. As we look to see if any questions coming through, just thank you so much. Your passion and your commitment just really comes through with everything you're sharing. So thank you so much. One question that came to mind for me, I was just curious, whether with United Healthcare or with the hospital, SSM, I'm just curious if you had any other, like you said, they'd like to hear some about numbers or some hard data potentially. Were you able to use any numbers to share with them, or is it, like you said, mostly being able to share the other type of data in terms of stories and that sort of impact?
We did share some data. We shared, and we don't have a lot of the health data. That is the problem. That is why it's so important that United Healthcare is going to share health data with us. We shared, and I hate the squishy word, but she's kind of right. I am kind of squishy in terms of telling the story, but I also know they have a huge impact on people. We were able to talk to the people we served in the pilot and, talk about, have you had to go back to the emergency room? Have you seen the lady who reduced her usage of oxygen about in half? So we were able to share some of that data, but I think it's really important as we partner with healthcare that they share data with us, because they're going to capture all that medical data that we are not going to, other than just asking some questions.
Great, and I'm thinking about also the national WAP evaluation. If folks don't have local evaluations, that's something that people can always bring with them when they go to such a meeting, to be able to show some of the non-energy impacts that came out of that evaluation from a few years back. So we could send that. We can send that around to folks when we share the slides with everybody too that attended today. Looks like we have one other. We have one other question here. Is the St. Louis Lunch and Learn open for other CAAs to attend as well, or WAP organizations?
We had not talked about that, but if there is someone from Missouri, and I would think that someone from Missouri is interested, get hold of me, and we'll certainly extend an invitation to you to come.
Great. It's exciting. Let's just wait a minute here, see if any other questions come through. And one question that comes to mind as well, Carla, it sounds like you really have I'd say, quite a partner on your side with Kevin Kennedy, it sounds like, the way you described that partnership there. Can you share a little bit more about his role? And I think you said, is he with United Healthcare, or maybe when folks are thinking about who to reach out to, at a hospital or insurance company, they can find out, what his title is. If you can share a little bit more about how that relationship came about.
Sure. Kevin Kennedy is with Mercy Hospital in Kansas City, and he has directed their Healthy Homes program for many, many years. When we first started getting into Healthy Homes in Missouri, he provided all of the training that certified our staff. He continues to provide Healthy Homes training across the nation. But he is really the pioneer in Missouri of Healthy Homes and speaks nationally. If anyone's interested, I would be more than happy. Actually, Catherine, I'll send his contact information to you to send out.
Right.
He is always willing to talk to anyone. And we are very lucky to have him in Missouri, and he, of course, goes to other states. But it's so important, as I said, you know, I am very passionate about what we do, and we have tremendous impact, as all of us do. But it's nice to have someone from a hospital there that truly does speak their language, that truly can say, we've been doing this. I've funded an organization. This works. It is so important to have that voice for the hospitals and the insurance companies.
Thank you. And also thinking about United Healthcare, I was just curious if you could share, which part of United Healthcare is that? Is it their corporate arm or the foundation arm? If you could share about that.
Yes, it is the corporate arm. It is the corporate arm of United Healthcare. And of course, in Missouri, it is out of their St. Louis corporate offices. But no, we have not touched the foundation yet. We are still working with the corporate offices.
Great. Well, thank you. And we've got your email here. So if folks do have questions, they can reach out to you directly. And otherwise, folks can also reach out to us here at the National Community Action Partnership, and we can connect you as well. But just want to say thank you so much for your time today, Carla, and thanks to everybody who was able to participate. I do just want to share a little bit further about here at NECAC and what we can offer you. Definitely being able to facilitate connections to experienced peers like Carla on the phone today. You know, if there's a certain topic interest you have around leveraging your weatherization dollars, we'll be sure to find someone that you can speak with further. And in addition, we have quite a few templates and tools to help you be able to say, if you're interested in utility partnerships, we have tools related to that. If you're, again, interested related to health-related partnerships, we can connect you with resources there. And, you know, if it's also, for instance, solar being a hot topic, if you're interested in solar-related issues, we can, and be sure to share what resources we have on that. So just wanted to share that. And also want to highlight a couple of upcoming webinars that we have. March 26th, 2 o'clock, we'll have NREL and IREC, National Renewable Energy Lab, and Interstate Renewable Energy Consortium, being able to show the recently released weatherization administrative training modules. So there's been quite a bit of work that has gone into that over the past, I'd say, a year or so. We really want to make sure you are aware of what those resources are for you. Also, with this being the 2020 census here right upon us, we also are looking to have a webinar talking about what you as weatherization agencies can do to help promote the census with those that we're working with. So we'll be having a webinar on that topic April 9th at 2 o'clock Eastern, and hope you can join in as well there. So before I close, I just want to make sure, Carla, was there any last comments you'd like to share or closing remarks?
You know, I don't think so. I think I've covered everything. All I can say is, you know, reach out, talk to your healthcare providers. We're more than happy to share what we're doing, but I think it is, you know, learn their language, learn what kind of things they're looking for, talk about your impact, talk about who you are and what you've done, which is, of course, your impact. There are lots of opportunities for us out there to bridge this gap. So we all need to be working on this, and I think we will only be stronger when we do.
Great. I do have actually one question that came through, Carla, and before we close. Someone was asking if you'd say there's someone in particular at United Healthcare, say in their state, you know, I think you know, is there a certain position within United Healthcare that they would reach out to, making sure that they hear about the importance of bridging the gap?
I think I think United Healthcare has done the navigators across their system. It's not just unique to the Missouri area. So I would try to find out who my housing navigator is, who my social determinants navigator is, and reach out to them.
Excellent. All right, well, I think that's all our questions for now, and really appreciate your time again, Carla, and thank you to everybody on the phone. So with that, that concludes our webinar. We'll see you at our next one. Take care.